Welcome back to the channel. Subscribe for more men's growth, mindset, self-improvement, and lifestyle content. Achieving a clear face and a defined jawline is less a matter of luck and more a measurable output of controlling surface inflammation and underlying muscle posture. To reach this state, we focus on three specific areas: managing inflammation, balancing surface chemistry, and adjusting the structural biomechanics of the lower face. To begin the protocol, you'll need a few physical tools: a basic cleanser, a light moisturizer, and a mirror. Over the next 30 days, we will deploy a daily habit designed to biologically clear the skin and sharpen the definition of the jawline. Because these steps address the face as an integrated system, the routine is most effective when followed as a complete, daily protocol. The first priority is acute triage, the method for handling active blemishes the moment they appear. When a blemish surfaces, most people instinctively try to physically manipulate or pop the inflamed follicle. Pressing the pore fractures its sidewalls, forcing bacteria deeper into healthy tissue. Instead, a cold compress shrinks engorged blood vessels, achieving thermal regulation without physical trauma. With the pore intact, a topical treatment then chemically neutralizes the remaining surface bacteria. Within minutes, this process typically results in a visible reduction in both redness and swelling. Managing these breakouts without causing secondary cellular damage is the first step toward long-term skin clarity. The next step is establishing a consistent chemical baseline through your daily wash. While many daily routines rely on abrasive scrubbing, our primary objective is the preservation of the skin's natural lipid barrier. This requires using strictly lukewarm water and a dime-sized amount of a basic cleanser. Follow the 60-second rule. This provides enough time for surfactants to lift debris and oils, while ensuring the protective barrier shown on the right remains intact. Avoid introducing high friction, such as scrubbing with rough towels or using scalding water, as both can strip the lipids you are trying to preserve. To finish the baseline, seal the skin with a light moisturizer. This step is necessary regardless of whether your skin type is oily or dry. You will know you have been successful when the skin feels supple to the touch, rather than tight or irritated. Maintaining this gentle baseline shifts the skin from a reactive state to a stable, proactive one. Beyond surface chemistry, we must address the underlying biomechanical structure of the lower face. Proper oral posture, often referred to as mewing, is the primary mechanism for improving the definition of the jawline over time. Suction the tongue flat against the roof of the mouth to engage the muscular sling under the chin. Support this with 10 repetitions of the chin tuck. Retract the skull horizontally backward, bringing the cervical spine into vertical alignment to further define the jawline. You should feel sustained muscular tension at the base of the neck and beneath the chin during each repetition. While genetics determine your base frame, these habits of muscular engagement and postural alignment allow you to maximize the structural definition of your face. This checklist forms the architecture of the routine: ice triage for breakouts, a 60-second gentle wash for the surface, and consistent palate posture for the structure. The challenge is to maintain these three variables without interruption for the next 30 days. 30 days of consistent application is the timeframe required to see measurable changes in both skin clarity and structural definition. A visible improvement in appearance isn't a matter of chance, it's the measurable outcome of applying consistent biological maintenance.